On behalf of County Durham and Darlington NHS Foundation Trust, I'd like to thank you for tuning into our blood culture video. Let me introduce you to our lead consultant microbiologist, Dr. Deepa Nair, who will explain why, when and who should take blood cultures.
Hello. Part of the process for identifying sepsis is to culture the organism which is causing an infection in your patient. The best diagnostic tool is to take blood cultures. This video is to raise awareness of doing this procedure correctly and highlights the importance of performing the procedure aseptically when taking blood cultures in order to be able to identify patients who have a bacterial infection. Blood cultures are an important investigation in the diagnosis of the septic patient. They are invasive and should be performed using a careful and aseptic technique. Failure to follow the correct technique will lead to contamination of blood culture bottles with skin bacteria. Contaminated blood cultures are wasteful of resources, difficult to interpret, and may lead to unnecessary antibiotic treatment for the patient. The decision to take blood cultures should always be made following a full clinical assessment of the patient, but in particular when the patient triggers the sepsis bundle, although it is important to note that signs of sepsis may be minimal or absent in the very young and the elderly, when the core temperature is outside of the normal range, tachycardia with or without hypotension or shock, chills or rigors, unexplained deterioration or worsening in the patient's condition, development of unexplained confusion, when there are focal signs of infection, a very high or a very low white blood cell count, EWS greater than 5, or when there are specific conditions like endocarditis. Blood cultures form part of the diagnostic workup of an unwell patient. It is inappropriate to delegate this task to another member of staff, as the cultures should be taken by the member of staff that has decided blood cultures are indicated. Some areas have identified clinicians who will perform this skillful task. Staff who are undertaking this procedure must be sure that they are competent to do so. This would require that they are aware of the current policy and best practice guidelines. The patient's consultant should be aware that sepsis is suspected and a blood culture is being taken. Blood cultures should be taken as soon as bacteremia is suspected and before the administration of antibiotic therapy. If a patient is already receiving antibiotics, then blood cultures should ideally be taken before the next dose is given. Care must be taken not to delay initiation of essential antibiotic treatment in patients where severe sepsis is suspected. By following the set guidelines as shown, we will provide an improved diagnostic services to our septic patients.
At the beginning of the procedure, it is very important to introduce yourself and explain to the patient why you're doing the procedure and making sure you obtain their consent.
Hello there, sir. My name is Alexei. I'm a junior doctor here. Can I just confirm your full name and date of birth?
That's Louis, and my date of birth is the 1/1/66.
Excellent. Well, it's very nice to meet you, sir. Now, today I understand that you've come in with a bit of a cough and a fever. Is that right?
Yeah.
Now, because of that, I've spoken to one of my microbiology colleagues, and they've recommended that we take a bit of a blood test from your arm, so we can grow a bug that could be causing all of your symptoms. Would that be something okay with you?
Yeah, that's fine by me.
Okay. And have you had your blood taken before?
Yes, I've had my blood taken before, yeah.
And do you have any needle phobias?
No, not at all, not bothered.
Excellent. So I'm just going to prepare my equipment.
Sure.
After formally checking the identity of the patient, you need to gather your equipment by first getting an aseptic trolley from the treatment room. Put a pair of ordinary gloves on and clean the trolley using a red top wipe. First on the bottom, then a separate wipe for the top. Gather up all the necessary equipment. If you can't find any blood culture packs in your clinical department, they are available from the pathology reception. If you're working in paediatrics, a separate blood culture pack is available, and this has a single bottle. Take out the equipment from the pack and place onto the bottom trolley. That's the instruction pack should you need some extra help, a dressing pack, a safety butterfly vacuum system, the blood culture bottles themselves, a tourniquet, a Chlorprep for cleaning skin, and finally 2 green Clinell wipes, which are used to cleaning the necks and tops of the bottle. Additional equipment will be required if you need to take extra blood samples, and finally a sharps bin. Open the top of the sharps bin so it's ready to take the sharps once the procedure is finished.
Going to wash my hands now.
The next step of the procedure is to wash your hands thoroughly in soap and water using the 6-step procedure. After your hands are dry, put on your apron. Firstly, open up your sterile dressing pack onto the top of the trolley. Open up the dressing pack as carefully as you can. The doctor will be using the clinical waste bag as a sleeve to be able to open up the contents of the dressing pack. Because you're going to be using quite a lot of equipment, you don't want it all piled on top of each other. And this allows the doctor to put into neat sections on the field that he'll be working on. Our blood culture packs are made up in our path lab. As it's not possible to autoclave the entire equipment, we must remember that they are clean but they're not sterile. So it is important to place your blood culture bottles at the side of your aseptic field to prevent cross-contamination. Open up a green Clinell wipe, which has got alcohol and chlorhexidine, and clean the top and the neck of the blood culture bottle. Use a separate wipe for each bottle and place at the side and allow to air dry.
Just going to place this drape underneath your arm, okay? Can I just ask you to lift your arm, please, sir?
Place a drape underneath the patient's arm.
It's fine. You can rest it down. Just gonna roll up your sleeve. Okay.
Apply the tourniquet.
Okay. Can you just lift up your arm? Thank you. Just gonna place this tourniquet around your arm. Might feel a bit tight. Okay, that's fine.
And look for a suitable vein.
Sorry about this. Just open and close it first for me. Excellent. Excellent. So I'm just going to give it a clean. Just time it for 30 seconds, okay?
Clean the patient's skin of the proposed collection site with Chloroflex for 30 seconds and allow to air dry. Please at this point do not repalpate unless you're wearing your sterile gloves.
Should be fine. Alright, so I'm just going to put my gloves on then.
Wash your hands with the alcohol sanitizer foam and allow to air dry. And then put on your sterile gloves. Warn the patient of the imminent injection of the needle.
You might feel a sharp scratch going in, alright?
That's fine.
Sharp scratch.
Collect first the blue aerobic bottle and then secondly the orange anaerobic bottle. For adults, you need to take about 8 to 10 mils of blood. For children, 3 to 5, or neonates 1 to 2 in each bottle. If any additional blood samples are then required, they then should be sampled last of all.
That should be fine.
Once the samples are collected, activate the safety mechanism of the safety butterfly and place directly into the sharps bin.
And that's fine. Just going to put it. Do you mind pressing here for me, sir? Thank you.
Once the blood samples have been collected, slowly agitate the contents inside the bottles.
Just remove that. Does it stop bleeding? Yeah. Just going to give you a dressing until it stops fully. Okay. There you go. Just lift your arm.
Clear equipment in the clinical waste bin and wash your hands.
We're just going to wash my hands again. So I just need to label these bottles, and what will happen is we'll send them off to the lab, and hopefully we'll have a result, a bug which is causing a symptom, grown as soon as possible.
It's fine.
Can you just confirm your full name and date of birth for me as well?
So my name is Louis and my date of birth is the 1st of January 1966.
Thank you, Mr. Lowe. Time is 11:30.
Document in the patient's notes the rationale of why the procedure was performed, including the date, time, lot numbers of the blood culture bottles used, the site of venipuncture, and if any complications were encountered. Please don't use the sticker on the bottles, as this is used in the pathology lab. If it is thought that the source of infection may come from a peripheral line or a central line, and it's deemed that this should be removed by the consultant, then please take it out and send the tip off to pathology for culture and sensitivity. If there is suspected bacteremia, it is generally recommended that at least 2 cultures should be taken at separate times and at sites.
So thank you very much for your time, Mr.
No
Lowy. So we'll send off these to the labs, and in the meantime, if you have any further temperatures, I'll come back and see you, and we might consider studying a course of antibiotics.
Yeah, that's fine.
Thank you.
The laboratory incubates all blood cultures for a minimum of 5 days. Culture for blood specimens is an automated process. Consultant microbiologists will communicate any positive results with the clinical team and advise appropriately. There is no need to telephone for negative blood culture results. The result and the advice given by the consultant microbiologist must be documented clearly in the patient's medical notes, and the advice must be acted upon. Care must be taken not to delay initiation of essential antibiotic treatment in patients where severe sepsis is suspected. Please remember the golden hour. The patient's consultant should be made aware of a positive blood culture result, and a clear management and review plan should be documented in the patient's case notes. Thank you for watching this video.